Last year, I opened the chest of a 67-year-old woman. Let's call her Elena. Elena was the kind of patient every doctor loves. She was sharp, active, walked 3 miles every morning, and never missed a checkup. She was doing everything right. But when I looked at her arteries during surgery, they didn't look like the flexible, living tissue they were meant to be. They looked like concrete pipes. They were so rigid, so calcified, that they felt more like stone than part of a human body. Elena was terrified. She asked me, "Doctor, how did this happen? I eat my greens, I watch my salt, and I take my heart-healthy supplements every single morning." I looked at the list of pills she was taking, the ones she'd been prescribed with the best intentions, and right there at the top of the list was the culprit, a supplement that millions of you are likely taking right now, believing you are protecting your bones or your heart. But in reality, for a body over 60, this supplement can act like a routing error, sending minerals into your arteries instead of your skeleton. Today, I'm going to tell you exactly which supplement you need to reconsider immediately. We are going to talk about why the plumbing model your doctor uses might be dangerously outdated. I'm going to show you the science, real peer-reviewed data that explains why this specific pill might be increasing your risk of a heart attack or stroke by up to 30%. But I'm not just here to give you bad news. I'm here to give you the rescue protocol. I'm going to share 5 things sitting in your kitchen right now that work better than any prescription to restore the non-stick coating of your arteries. If you are over 60 or if you care for someone who is, please stay with me. This is the conversation the medical system often doesn't have time to give you in a 10-minute appointment. This information saved Elena's life, and it might just save yours. To understand why this supplement is so dangerous, we have to look at what is actually happening inside your body as you age. Most doctors explain high blood pressure as a plumbing problem, too much fluid in the pipes. But after 30 years as a surgeon, I can tell you that the real cause of the trouble isn't the fluid, it's the walls of the pipes. Think of your blood vessels like a garden hose. When you're young, that hose is brand new, it's flexible rubber. When the water pressure goes up, the hose stretches and absorbs the force. But as we age, those walls start to stiffen. They lose their elasticity. Imagine that same hose left out in the sun for 20 years. It becomes brittle, it becomes rigid, and a rigid hose can't handle pressure. This is what I see on the operating table, arteries that have lost their shock absorber quality. The silent enemy, chronic inflammation. Why do they stiffen? The answer is chronic, silent, slow-burning inflammation. You don't feel it, there's no fever or pain, but day after day, year after year, this inflammation quietly narrows your vessels, forcing your heart to work harder and harder just to push blood through. And here is where the supplement comes in. When you have this inflammation, your body's internal non-stick coating, something scientists call the glycocalyx, begins to erode. Imagine the lining of a Teflon frying pan. When it's intact, nothing sticks, but when that coating is gone, everything sticks to the walls. When you take the supplement I'm about to reveal, and your glycocalyx is damaged, the minerals in that pill don't go to your bones. They stick to your inflamed artery walls, turning them into stone. The supplement you must reconsider: calcium. Now, I know what you're thinking. "Doctor, my doctor told me I need calcium for my osteoporosis," or "I've been taking this for 20 years to keep my bones strong." I want to be very clear. I am not saying calcium is evil. Your body needs it, but the way we supplement it after age 60 is where the tragedy happens. In 2010, the British Medical Journal published a study that sent shockwaves into the cardiology community, though it rarely made it into the news you watch at home. They followed 12,000 patients taking calcium supplements. What they found was a 30% increase in cardiovascular events like heart attacks and strokes. The calcium paradox. Why? Because when you take a large concentrated dose of supplemental calcium, often 1,200 milligrams at once, it enters your bloodstream as a sudden, massive surge. If your body doesn't have the right traffic controllers, it doesn't know where to put that mineral. Instead of going to your hips or your spine, it drifts. It settles in the plaque in your coronary arteries. It settles in the walls of your aorta. This is the calcium paradox. You take a pill to protect your bones, but you end up calcifying your heart instead. As a surgeon, I've felt this. I've held hearts where the arteries are so filled with calcium, they actually crunch under surgical instruments. And most of those patients were doing exactly what Elena did. They were taking their daily calcium supplement religiously, believing it was heart healthy. The medical system failed Elena because it gave her the bricks, calcium, but didn't give her the masons to lay them correctly. If you are going to take calcium, or even if you just want to clear your arteries of the calcium already there, you need two essential tools that are almost never discussed in a standard checkup. 1. Vitamin K2, the traffic controller. Your body has a protein called MGP, matrix GLA protein. Its only job is to grab calcium from your arteries and send it to your bones. But MGP is like a car without a key. It is inactive until it's turned on by vitamin K2, specifically the form called MK7. Without K2, the calcium is lost. It stays in the blood vessels. But when you have enough K2, it acts like a traffic warden, directing the calcium out of your heart and into your skeleton. The Rotterdam Heart Study showed that people with the highest K2 intake had significantly lower rates of arterial calcification. 2. Magnesium, the natural relaxer. Magnesium is what I call the natural calcium channel blocker. If you've ever been prescribed a drug like amlodipine, that is a pharmaceutical calcium channel blocker. It works by preventing calcium from rushing into the muscle cells of your artery walls, which causes them to tighten. Magnesium does the exact same thing naturally. It tells your arteries to relax. It tells them to open up. Yet 60 to 70% of adults over 60 are deficient in magnesium. And here is the kicker. Standard blood tests won't show it because only 1% of your magnesium is in your blood. The rest is inside your cells. If you have muscle cramps at 3 a.m., if your heart skips a beat, or if you feel anxious, your body is likely screaming for magnesium. Taking calcium without magnesium is like putting more pressure on a system that is already too tight. If you're ready to move away from the pill for every ill approach and start supporting your machinery, I want you to look in your kitchen. There are 5 things you can start doing tonight that work better than any prescription to restore the non-stick coating of your arteries. 1. The vegetables first rule. When you sit down for dinner, what do you reach for first? The bread? The meat? I want you to change one thing. Eat your vegetables first. When you eat fiber first, it forms a physical mesh in your stomach. This barrier slows down how fast sugar enters your bloodstream. Why does that matter? Because every time your blood sugar spikes, your body floods with insulin. That insulin surge causes your blood vessels to constrict right there at the dinner table. By eating greens first, you keep your vessels relaxed. 2. Apple cider vinegar, ACV. This isn't just a trend, it's chemistry. 1 to 2 tablespoons of ACV in a glass of water with your meal does 2 things. First, it improves insulin sensitivity, blunting those sugar spikes. Second, it stimulates nitric oxide. Nitric oxide is a Nobel Prize-winning molecule that acts as your body's natural vasodilator. It tells your arteries to relax and open up. It's a $3 bottle that does what expensive medications try to do. Just remember, always dilute it and use a straw to protect your teeth. 3. The 3 a.m. walnut habit. If you wake up with nighttime hypertension, where your pressure spikes while you're dreaming, you need walnuts. About 30 grams, 14 halves, eaten 30 minutes before bed can help. Walnuts are rich in alpha-linolenic acid and omega-3, melatonin, and L-arginine. Together, they work to relax your vessel walls and support the nighttime dip your heart needs to recover. 4. Hibiscus tea, the natural ACE inhibitor. Modern cardiology has finally caught up with what traditional medicine has known for centuries. 3 cups of hibiscus tea a day can act like a natural ACE inhibitor. ACE inhibitors are common blood pressure drugs that block an enzyme that constrict your vessels. Hibiscus does the same thing, often without the annoying dry cough side effect of the pills. In one study, it reduced systolic pressure by an average of 7 points. That is clinically significant. 5. The oil swap. This might be the most important change you make. Look in your cupboard. If you have canola oil, soybean oil, or sunflower oil, you are feeding the fire of systemic inflammation. These oils are high in omega-6 and are unstable at high heat. When they oxidize, they break down into aldehydes, which are directly toxic to your blood vessel walls. Swap them for extra virgin olive oil. It's